And in my playbook tonight, I guess you could say that we have Exhibit A in a case for a public option. The stories just keep coming, don't they, folks? The greed of the health insurance giant Aetna is going to force more than 500,000 people, those clients, to lose their coverage. Aetna they didn't make much money, in the last quarter, so they're jacking up their rates for 2010. How many of you got that candygram in the mail? That's a move that the company admits will make up to 650,000 people lose their health insurance. Joining me now is the founding editor of Huffington Post, Roy Sekoff. They just keep coming at us, don't they, Roy?
Ed, this is what happens when you make the health and well-being of the American people a bottom-line business. And it's, as you said, it's Exhibit A, why we need a public option. And we need a strong public option, and we need a public option that starts on day one, not 2014. As you say, they only made 28% more in the third quarter last year than they did the year before. So they had to jack the prices up.
And such stuff as that, maybe they'd have more for profit. Here's a couple of numbers that I think are really pertinent. Aetna's decline in profit margins behind the decision to jack up the prices. Their profit margin declining over time in 2007, 11.1%. Then in 2008, it went to 10.3%. And then this third quarter of 2009, it went to 6.9%. The source, of course, the American Medical News. Now, the results the last time they pulled a stunt like this, in membership in 1999, it was at 21 million. In 2003, when they made this move, they cut down to 13 million, and there you see the profit margin that went from 4 to 7%. If this is the way it's going to be, and if we are going to run healthcare in this country strictly for profit, the number of people without insurance is only going to go up, which is only going to make it tougher on our economy.
And of course,
go ahead.
They had to raise the rates, but they had enough money to lobby to the tune of $2 million already this year. And don't forget, where is Aetna headquartered? Connecticut, home of Joe Lieberman, who again this week told us that he just can't get behind a public option. If you got a pen, Ed, we could connect the dots.
Well, they've got a pattern of prioritizing premiums over membership. So I don't know how the Republicans would defend this. Now, it would seem to me that in the middle of this debate that's going on, the senators are going to work over the weekend, that stories like this would give them all the ammunition they need to close this deal. What do you think?
You think so, but I think, the crinkling of the money speaks a little louder in the ears of Joe Lieberman and Blanche Lincoln and Nelson. This is the problem. I mean, the influence of special interest money, Ed, is just, it's redolent on this issue. The stink is powerful.
Okay, what should, the other night on this program, Barbara Boxer told me I'm too hard on the Democrats, that, they're going to get a public option. But then I listened to Ben Nelson, I listened to Joe Lieberman, Blanche Lincoln. They're not going to show up for a public plan. If you had to call it right now, what's the call?
I'm getting terrified, Ed, when you've got Dick Durbin, who's a progressive member of the Senate, saying, we still haven't gotten rid of the trigger option. We're still looking at that because maybe we got to bring Olympia Snow back in. That's when I start biting my nails and getting nervous. So
what should the progressive movement do with these conservative Democrats that won't line up? I mean, is it worth getting together and trying to take them out with a better candidate and look at this as a generational effort?
I think you have to. I mean, that's what we saw throughout the course of this. And they've been wanting to quit on the public option again and again and again. And the only thing that kept it going was the public, the grassroots, keeping the pressure on. That's why Harry Reid was ready to give it up, and then he came back into the fold. And that's why Barack Obama, was ready to give it up, and he slowly has come back, although not with the kind of force that we've needed him to do it in.